Welcome to INOvators, a series where we sit down with thought leaders across the healthcare space to discuss some of the industry's most pressing topics. Joining me today is Kimberly Swanson, Chief Strategy Officer at Healthmine and a repeat guest on INOvators. And today we're going to talk about agentic AI and its impact on health plans and health plan members. Great having you here today, Kimberly.
Thank you. Thank you for having me back.
We know that health plans right now are inundated with AI solutions. From your perspective, why would appointment scheduling be such a powerful but also realistic entry point for starting to use agentic AI?
Yeah, that's a great question. So, like you said, AI is everywhere, and health plans don't even know where to start. There's so many solutions out there that aren't actually even solving the daily pain points of health plans. And if you think about appointment scheduling, that is a pain point for members, providers, and health plans. So it's a really natural way to start. Also, if you think of traditional outreach methods, it's really expensive for health plans. They're using letters, phone calls, and a lot of different nudges that members don't even always respond to. And so when you think of agentic AI scheduling, it really does solve the problem in a lot of different ways. It's easy for the members to use. It's a much lower cost solution, and it really drives the members to care.
Let's look at the numbers. How are members actually responding to these outreach methods?
Yeah, that's a really good question. And I'll say that what we are seeing is that health plans that are really integrating AI into the experience, they're seeing a lot of adoption. And that actually is across all lines of business. I think there's a myth out there that Medicare Advantage members won't adopt and use technology, and we're not seeing that at all. For our Medicare Advantage members, we're seeing about 57% of the members using AI agents. Of those, about 77 schedule an appointment, and of those, 73 complete the appointment, which is huge. And even among the Medicaid population, we're seeing about 35% engage with the AI agent and about 32% complete an appointment. So as you can see, there's really growing adoption of AI tools, but most importantly, there's an increase in those completed visits. And for a health plan, that's just huge because more visits mean, more quality and risk gap closure. And for the members, it means they're actually getting the care that they need to stay healthy.
So even Medicare Advantage members, who are often considered a harder to engage population, they're responding well?
Yes, they are. We're seeing growing adoption. But, something to really keep in mind for that is that you need to keep it simple for Medicare Advantage members, and you need to make it human-like. For them to engage with AI, it needs to feel natural, and they need to trust. So there is, that process of getting them comfortable, and the easier and more simple and human-like solutions that you use, the more adoption you'll get.
Walk me through what this looks like for a member. What is agentic AI really making easier for them specifically?
Yeah, that's great. So let's take Maria. She's a Medicare Advantage member who is due for her annual wellness visit. So how it works is the AI agent will text Maria and remind her that she's due for her annual visit. Then it will ask her if she wants help scheduling her visit. If she says yes, then she will provide her preferences for her provider, what language, what gender, what location. And then she'll also provide her preferences for an appointment, so which days of the week and what time. That's all that she has to do. Then the AI agent takes it from there and will call the provider's office, navigate the confusing phone tree, get a hold of the front staff, and actually book that appointment. And interestingly enough, we're also seeing that the provider's staff really likes using AI because they don't have to waste their valuable time talking to members, talking about the weather, all of those type of things. So then Maria will get a text message back shortly confirming her appointment time and her provider's name and address. It's as simple as that.
And I'm sure that there's some benefit to our health plan viewers who I'm sure are watching as well.
Yes, absolutely. So that, if you think about all of the pain and headaches that we've all used in trying to get members into care, again, using traditional outreach methods, which are really expensive in terms of people resources calling, letters that are thrown away. This is a completely digital solution, and it automates all of those manual and uncoordinated processes. And then on the back end too, if Maria needs to change her appointment, she doesn't need to call anybody. She just needs to use that same message and update her appointment with the AI agent. So it just removes barriers all across the way, and it's an easy win for the member, the health plan, both of them. And not only does it decrease costs, but it also improves the member experience as well.
And everyone is looking to save time and lower costs. So let's talk about those savings, because the numbers are certainly eye-opening.
Yes, absolutely. When you think of a traditional call center operations, it takes on average about 19 weeks to train a call center agent, train them really well. If you think about implementing AI, you can implement an AI agent in less than 4 weeks. So that's a difference of 105 days. So you can go much faster and quicker with AI and still get high quality.
That's impressive. You've talked about how powerful scheduling is, but beyond these primary care physician visits, what are other high-value use cases where this technology is really making a difference?
That's a really great point, because AI just isn't just about convenience. It really is about reducing barriers for vulnerable populations. So when you think about members that struggle with transportation or health literacy or have complex care, scheduling can be a huge hurdle. They don't even know where to start. And AI can be as simple as just a text message. And you and I spent a lot of time on the last podcast talking about the importance of reaching those hard to engage members, because they truly do need the care, and the plans really do need to find them. So this is a great way to do it. So outside of primary care, agentic AI scheduling can be used for preventative services like breast cancer screening and making sure that all your members are getting their mammographies. Many plans right now are using FitKit tests or Cologuard tests to screen for colon cancer screening. And once there's a positive, the member needs to go in for their full colonoscopy. So this is really easy for the AI agent to do that screening, find them, a GI, and get the full colonoscopy, which is going to be more and more important in the future, because it is going to be a HEDIS and eventually a STAR measure. It also can be used for in-home assessments and those important PCP reminders and follow-ups, as well as behavioral health.
And like we said, there are tons of AI tools, different technology that's being used today, but what makes the difference between a tool that members are actually going to use and want to use and one that they will likely just ignore?
Yeah, that's a good question. That's where it really comes down to design and empathy of the AI agent. A really good HIPAA-compliant AI agent needs to listen, respond, and adapt. It cannot be rigid. You really do have to have that human-like experience. Because once a member has a successfully scheduled visit, we know that they're going to use it over and over again because they trusted the experience. So the member really had a solid experience, and they will do it again. And that's all, what we want them to do. The health plan needs this ongoing engagement with the member. So if it's going to see your annual wellness visit, then the next is to schedule, your mammography, all of those types of things. This natural AI is really, really important.
So when health plans focus on practical AI use cases like scheduling, they're more likely to see the immediate results that are going to build kind of that trust and efficiency.
Yes, and this is really how, when we're talking about real life examples of AI and the results, and getting members in to see their doctors and getting them the care that they can receive is tangential results.
So, Kimberly, if our listeners are wanting to learn more about anything that we've discussed today, where can we direct them to you and your team?
Yes, yeah. If you go to the Healthmine website, you can schedule a demo of our QRM Connect solution. And it's real time too, where we can walk you through, it on your phone. You can see how the text experience, and you can see the AI agent experience. So absolutely reach out to Healthmine.
Okay, awesome. Well, Kimberly, it has been a pleasure chatting with you today. Thank you for being back with us, and of course for your continued partnership.
Thank you for having me.
And to our audience, thank you for watching today. Be sure to keep an eye out for our next episode of INOvators.